This is Lisa. She has just left the clinic without getting the sexual and reproductive health SRH service she needs. Lisa is like a lot of us young people. We are extremely affected by lack of youth-friendly SRH services in our health facilities. These services are required of our governments to provide them. Governments are obliged to effectively deliver public sexual and reproductive health services which progressively realize people's rights. Not being able to access SRH services is a violation of the right to health. Citizens should hold the government and policymakers accountable for obligations towards realization of human rights. We call this Social Accountability Monitoring, or SAM. With SAM in mind, SAFAIDS is running the MobiSAfAIDS app to empower young people like Lisa to hold policymakers in their communities and countries accountable towards delivery of youth-friendly SRH services. To use the MobiSAfAIDS app, you need an internet connection. After downloading the app from the Play Store, select Register for an account option on the opening screen. Thereafter, you will be taken to the MobiSAfAIDS page, where you will scroll down and fill in your information under New User Registration. At this point, you can choose a nickname as your username if you wish to remain anonymous. After filling in your information, click the Register button. You will receive a notification that a MobiSAfAIDS system administrator will activate your account. Once your account has been activated, you will now be able to log in and use the app. Submitting an issue is simple. Log back into the MobiSAfAIDS app by filling in your username and password. Once you are logged in, click on the red button at the bottom right of the screen to create the ticket and fill in the required information from the drop-down menus as well as a brief description of your issue, and your ticket will be ready for submission. Click the green button to submit. Your ticket will be saved and you will have the option of adding any extra details such as a picture, voice note, or video. Thereafter, you will be given a ticket number as well as a summary of your issue including its status. Our system will capture information and inform the relevant healthcare facility admin of this new ticket. The healthcare facility admin will assign the ticket to a healthcare service provider to address. Our system will notify you that the ticket has been assigned, and the responsibility will be on the service provider to resolve the SRH service issue, marking it as resolved once it has been addressed. Our system will notify both you and the healthcare facility admin that the service provider has resolved the issue. With the issue marked as resolved, you will now be able to close the ticket. If the issue has not been resolved satisfactorily, you can mark the ticket as unresolved. The healthcare facility admin will follow up with the healthcare service provider to address this issue further. Apart from you and the healthcare facility staff, the data from the MobiSAfAIDS is accessible to other stakeholders who will support young people to demand accountability from the state. By linking young people, youth-led CSOs, ward councillors, Ministry of Health officials, local MPs, healthcare facility administrators, healthcare service providers, SAFAIDS country-level administrators, and SAFAIDS oversight administrators, the MobiSAfAIDS is designed to strengthen accountability of healthcare service providers in delivering youth-friendly SRH services through digital citizen engagement. And don't worry, if you get stuck at any point, our friendly SAFAIDS SAM for SRHR champions and local organization will be available to help. MobiSAfAIDS was created by MobiSAM, Department of Information Systems at Rhodes University. The SAFAIDS Transforming Lives programs is generously supported by Sweden. SAFAIDS, knowledge for action, the power to make a difference.